you so much. Recording in progress. Never gets old. Well, thank you so much, Tim, for that introduction. I was trying to figure out just before you were talking about when it was that I last came. And yeah, September 2019. So there's a whole lot that has happened in the world since I last came in and since I last spoke about the Yoga4Health program. So thank you so much for having me back. I'm really, really pleased to be here. So my name's Leanne. It's a bit confusing because I'm listed here as Leanne Antonia Wellbeing. That's very much my business. But my full name's Leanne Tessier-D'Silva. And yeah, here to talk all about yoga on prescription, which is really the kind of name of the book that was given, which I'll go into more detail about later, about the Yoga4Health program, which is what this talk is all going to be about. So can't wait to share with you. And I know that when we last had the talk in person, we had a really good turnout of people as well. So hopefully there's a lot of interest in this in this chat. So if you don't mind, I am just going to screen share. So give me just a moment to make sure I'm sharing the right thing. I do have a presentation for this. I just want to check you can give me a thumbs up just to let me know that you can see the slides on there. Perfect. Thank you so much. I'm just going to pop you over here. Wonderful. All right. So yeah, talking all about bringing evidence-based yoga into healthcare is very much what the Yoga4Health program is about. And just to give a really quick top line summary of what we're going to be seeing, hearing about today, is talking a little bit about the Yoga in Healthcare Alliance, the rationale behind the Yoga4Health program or the motivation behind it, a little bit of detail about the Yoga4Health program and what it actually is, and the research behind it, which I was very lucky to be a participant in delivering the sessions, and kind of talking a little bit about that bridge between, you know, kind of what Tim was just alluding to, kind of what's next, how do people get to the Yoga4Health program and what are we doing to kind of promote it, and then leaving some space at the end for questions and answers. So the context of really what this is, on the International Day of Yoga, the Prime Minister Narendra Modi, on the very launch of the very first International Day of Yoga, explained yoga as an invaluable gift of India's ancient tradition. It embodies unity of mind and body, thought and action, restraint and fulfillment, harmony between man and nature, and is a holistic approach to health and well-being. It's not about exercise, but to discover the sense of oneness with yourself, the world, and nature. And by changing our lifestyle and creating consciousness, it can help in our well-being. And so really that sits as a real centerpiece of what the Yoga in Healthcare Alliance is about, or YIHA, as Tim likes saying with that little accentuation. But YIHA is a not-for-profit working to bring yoga into healthcare. It's supported by the APPG, so that's the All-Party Parliamentary Group on Yoga in Society, and as well as the Royal College of Medicine and Integrated Health. Its vision is very much to promote health and well-being by making yoga more accessible, to work as much as possible with the NHS and its various kind of tendrils, supporting it as a unique position as, you know, a kind of countrywide health service, and to create a successful model that we hope can be used to help to integrate yoga into more healthcare systems around the world. You never know. And just to kind of really go over some of its aims and its kind of dedications as well, YIHA is very much committed to creating a dialogue between all the different schools of yoga, of which there are so many, to offer a unified yet diverse vision of yoga's role and potential that it can offer in healthcare, to raise awareness of all the benefits of yoga by disseminating and also creating research evidence, to help to empower individuals to take active roles in maintaining and restoring their own health and well-being through the practices of yoga, giving guidance to governing bodies, to medical institutions regarding which types of yoga are supported by evidence, and for which ailments where applicable, and communicating and collaborating with healthcare policy via the APPG, the Yoga in Society, and increasing accessibility to yoga for all populations. And so the rationale of the program, there's obviously a huge amount of need for support in the NHS. It was obviously set up in 1948 and was there to provide care for all, regardless of any ability to pay. But yet it's under more and more pressure each and every year. And I feel as though that pressure has surmounted even more following a mix of Brexit and COVID-19 as well, where, at least from my experience, from many friends who were in the healthcare profession, people have left in recent years, which is really sad to see. And, you know, the NHS is losing some fantastic staff as the pressure becomes even more. And although traditionally the NHS was really working on combating infectious disease, really in recent years, it's starting to shift a lot towards treating lifestyle factors. And to give some context, about 80% of all GP visits have some stress-related component, which is really significant and really huge and speaks to the kind of value where yoga and all kind of alternative mind-body practices can play a huge part in kind of supporting these vital services and freeing up space, you know, for people who do have more chronic conditions. And Yoga4Health is very much aimed at those at risk from developing chronic long-term conditions, because what can start off as stress-related components that can then become embedded behaviors that can then become, you know, slightly more serious, starting to impact on our physiology, and then ultimately can result in a long-term condition. And we're starting to see an increase in a rise of chronic diseases, and there's a variety of reasons for this. Reduce self-efficacy. This is the ability that, well, I should say what's the word I'm looking for? It's the ability that one person has in oneself, the belief, that's the word, the belief they have in their oneself to be able to play an active role in managing their own well-being. And of course, society is getting even more stressful, and we're simply vastly without coping strategies, especially people who don't practice yoga. You know, they don't have the wisdom that yoga provides from that as well. And just to give a little bit of context for the sort of, you know, how things are, about a third of hospital visits are for chest pain. And in many cases, the chest pain is simply related to panic or anxiety or stress and a lack of understanding how to reduce it. So it's really interesting how there's really a kind of a lack of understanding of how to manage our own well-being and how active we can play a part in it as well. Of course, people are living longer, more likely to have a lifestyle disease, technically, because we're being around longer. And of course, the big piece of loneliness. Reduce social interaction, reduces one's mood, and it's a real big risk factor in many health conditions and poor health behaviours, which is exactly why social prescribing was set up as an institution. We're seeing a rise in mental health conditions and a decrease in diet. And I would say that that's kind of linked to a lot of things at a societal level, but also really impacted at the moment by the cost of living and people having to make choices you know, around food, which we don't wish on them. And so just to give a little bit of a visual kind of idea of here to sort of show that mental health basically has an increase in healthcare costs here. Those with type 2 diabetes and poor mental health over on the left-hand side, are shown to kind of cost the NHS more money. So this kind of idea of two conditions existing alongside each other. The word I don't particularly like using it, but it's referred to as comorbidities here. And then, it's linked into here with a higher kind of type of cost. You can kind of see what the types of cost are just at the bottom here, from inpatients to prescribing, and the cost in primary care visits is also higher as well. And again, just for this little bit of context, we're looking at the big picture to begin. In 2017, I would like a slightly more up-to-date statistic on this, but about 16.4% of the UK population in 2017 had a mental health condition, with 24% receiving treatment for one. And in the UK, stress is responsible for the main burden of disease, which I think is a very interesting factor. It's really a big contributor in so many different chronic conditions. And with something a little bit more up to date here, after COVID, those who were experiencing distress during COVID, about 10% of the UK population is still experiencing persistent distress. And the main groups that affects are generally women, young people 18 to 30, and those with pre-existing mental or physical health conditions, as well as those living in deprived areas and ethnic minorities. So whereas we had a significant portion of the UK experiencing distress during the pandemic that has now returned to normal levels, or the levels before the pandemic, there's about 10% who are experiencing distress during COVID, mental distress, anxiety, depression, or some other mental health condition that is still ongoing and high, despite, us being, I don't know if you can say we're post-pandemic, but we're certainly not living with lockdowns or many restrictions. And so, just to sort of say that about 40% of CCG budgets, CCGs are clinical commissioning groups. They're kind of these large, areas that look after large swathes of each kind of region. They go towards hospital visits, and about 40% are towards emergency care. And people with long-term conditions, or treatment for care with those with long-term conditions, is estimated to take about 70% of the total health and social care expenditure. So the treatment of long-term chronic conditions is the thing that costs the NHS the most amount of money. Type 2 diabetes is probably the most kind of costly condition out of all in the NHS. And of course, those who are slightly older or socially isolated are more likely to present to health services. And that's really linked to kind of like a loneliness, a lack of support network as well. And we have about 24% of the UK population for those who have multiple health conditions. So it's really, we're talking about Yoga4Health as a program being able to support that number not increasing, and to maybe stop more people kind of adding into that percentage, and maybe in the long term reducing that number of people with multiple long-term chronic conditions. And so let's think a little bit about yoga, kind of bringing it back from the big picture, a little bit kind of narrower. Really, yoga has a huge role in prevention of chronic conditions that cost not only the NHS the most amount of money, but also have the most impact on an individual's life. It can help reduce anxiety. This is really related to that chest pain piece of those people attending A&E, and a significant portion of them being related to stress and panic and anxiety rather than something else. Yoga has a really good, it says I've put here supporting older people, but actually I would say really supporting all people in reducing social isolation and promoting self-efficacy by giving people really practical tools to help to manage their own well-being and increase that sense of confidence that if I do something, I will create a change. or at least I can try and it might make a change. And yoga, because of the way that it looks at people from a multifaceted mind-body lens and beyond, I would say, it really can help us to focus on people who have various comorbidities, who have a mental health condition and a physical health condition, or who have multiple mental and physical health conditions. And so just to give you a tiny bit of information on the research, and there is such a big body of research around yoga and its role in helping people. And this is research that's not related to the Yoga4Health program, but some other interesting pieces. This was a great study in 2012 about a 12-week course, so 2 weeks longer than Yoga4Health, which was for 75 minutes every week for 12 weeks versus usual care for chronic or reoccurring lower back pain. And the yoga group had a much greater improvement than the usual care, taking in the year following 8.5 less sick days due to back pain on average. And the yoga group report an increased quality of life with regards to their health as well. And probably out of most areas, yoga for lower back pain probably has the most volume of research in it, just because people have been researching it, I would say, for a little bit longer. And if we stay with lower back pain, a 2015 study, which was 159 participants, it was a medical yoga group, so a kind of a therapeutic kind of group. And there were 3, so it was yoga group, more therapeutic yoga versus exercise versus usual care. And it was shown that medical yoga was superior to usual care when considering the long-term effects on quality of life. And it reduced absences. Again, it reduced it by 17.5 less days, which is a huge amount of time considering it was a group of people who were suffering from chronic lower back pain. And when compared with exercise, yoga came out higher in terms of quality of life over time as well. And it was a Swedish study, so there was a cost saving, or an estimated cost saving around it, of about $150,000. That's not in the Swedish krona or in the euro, but in $150,000 per person per annum. And this is a really large study which was done at Harvard in 2015, which was in a cohort of 17,000 patients. Around a quarter practiced a mind-body technique, and it was kind of it was a mix of kind of yoga, mindfulness, and positive psychology. And so those practicing the mind-body techniques presented to health services about 43% less than before they started these practices, and used healthcare in general 25% less than the control group. And so there was a massive cost saving there of about £2,360 from reduced emergency visits. So if we took into account primary care as well, we probably have a little bit of a greater saving. And then, just to kind of bring it back, that yoga is correlated with better health and health behaviors as well. So you can see that on the left-hand side here, yoga practitioners regularly rate themselves as kind of, more moderately mentally healthy or flourishing, higher percentages of both. And we've got those who are the average US citizen in this study. There's a greater percentage who are languishing. And on the right-hand side, you can see that yoga practitioners are more likely to be vegetarian, they're less likely to be smokers, they're less likely to be obese, they're more likely to consume alcohol though. But when sort of dissecting and talking about this study, perhaps, they're doing it more mindfully, perhaps there's other mechanisms as well, but, we don't know. That's a little bit of speculation from my part. And generally yoga is kind of seen as comparative, if not more effective, to other kind of interventions, particularly with mental health conditions. It's shown to have kind of really great kind of efficacy in particularly things like treatment-resistant depression as well. I won't go into the details of these studies here. And yeah, there's a couple of mechanisms whereby yoga could be improving people's mental health. There's definitely a change in the biomedical environment, the physiological environment within us, sort of increasing certain levels of neurotransmitters, reducing levels of hormones in the body that activate the stress response. Yoga is very much generally practiced as a community. So, you know, even if it is just the working with someone one-to-one, like a yoga teacher, you're still creating that idea of social support. It increases heart rate variability, which is a gauge, really good gauge of kind of health of the nervous system, and also a gauge of how resilient one is, how much someone can come back and bounce back from stress. It can obviously create kind of neuroplastic kind of benefits. So we can start seeing brain changes, you know, over time with regular practice. And because of yoga's, you know, ideas behind it, the philosophy, things like the yamas and niyamas, there's a bit of a shift in worldview when one starts practicing yoga on a more regular basis, from moving from I towards the outside world, or, you know, us within a wider world, from doubt to faith or trust. It fosters community, and it fosters this idea of self-efficacy, this fact that we can play an active part in our well-being, from, you know, and it's from as simple as sort of sticking to a yoga practice and attending each week and kind of noticing, I'm starting to get more flexible in this particular part of my body. And then maybe when they don't attend a practice for a few weeks, I'm, you know, getting slightly less flexible in that part I previously had flexibility with. And for many people, that's the start of their yoga journey, but obviously it then kind of goes on from there. And finally, just kind of, I think I'm jumping back one, but yoga has been shown to be superior in the treatment of things like PTSD as well. And compared to CBT, but also there are other studies around DBT, which is probably one of the gold standards of kind of therapeutic interventions, or talk therapy interventions, particularly for the treatment of PTSD. Yoga has been shown to be kind of as effective, if not more effective, kind of all over. And yeah, as well, kind of, you know, one of the things that's found from so many research studies about yoga is that there's an improved mood and reduced stress. It's pretty much what it boils down to in terms of studies around yoga interventions. And this is generally found whether mental health is the actual thing that's being measured and being researched into, or whether it ends up being a side effect of, maybe they're researching into lower back pain, but actually we're finding a reduction in depression, an increase in mood as well. And yeah, yoga has always been a practice in terms of creating long-term changes. We see this through the changes that appear on brain scans. So it fosters positive neuroplasticity. And it's always been a practice of enhancing mental well-being. That's been very much apart from yoga's lineage, ancient lineage. And yoga is very much an integrated system. So it's actually incorporating many things that are already used in healthcare. And I think people, one of the things that I think is frustrating for so many yoga teachers is this word evidence-based, about trying to find research to prove yoga, when really there's not necessarily, this research, this evidence base is growing. And just because we don't necessarily have the evidence for it yet that's been published in a peer-reviewed study, it doesn't mean that the evidence of one's personal practice and noticing the changes that they have. And very much the practice of yoga was using the scientific method traditionally. You would try a practice, you would see if it worked. And generally the findings which created this kind of yoga history of saying that yoga could be used for certain conditions and everything comes from trial and error throughout the years. So it does definitely have an evidence base. It's just not necessarily a recorded one. And yeah, generally yoga's view on health is that it's not pathologizing. It's not boiling us down to just a condition, to just a diagnosis. It teaches us really that at each of our centers, we are all inherently well and have the potential to be inherently well as well, even if we have a physical health condition or a mental health condition. And it teaches us that we're all connected to something that is bigger than ourselves. It's associated with self-reliance, teaches us that actions have consequences, both positive and negative, and believes that all people have the potential to change their state. And, this is seen throughout with studies that yoga is equated with greater self-efficacy, or yoga practice is. And there's a nice quote here from Professor Doraiswamy at Duke, which is the search for improved treatments, including non-drug-based, to meet the holistic needs of patients is of paramount importance. And we call for more research into yoga as a global priority. If the promise of yoga on mental health was found in a drug, it would simply be the best-selling medication worldwide. And yeah, just kind of going back a little bit to the research here, there's a big link as well between mental and physical health problems, which is really where practices like that offered on the Yoga4Health can really kind of benefit. About 30% of all people will have a long-term physical health condition and a mental health problem at the same time, with depression and anxiety being the most common. And mental health problems can seriously exacerbate physical illnesses. It worsens physical health conditions when there's a dual diagnosis there. And we can see as well that mental health problems have a dramatic impact on life expectancy. There's even sort of some research around linking depression, saying that depression is as much of a risk factor for things like cardiovascular disease when smoking is. And it disproportionately affects communities who are underserved more greatly as well, which can really affect kind of life expectancy. And mental health problems co-present with many physical issues in which poor mental health is a contributor. So this can be chronic pain, diabetes, back pain, and also autoimmune conditions as well. So I've talked a lot so far. And so I wanted to offer us a little bit of a breather here, and I'm just going to stop sharing briefly, but then I'm going to come back in. It's nice to see everyone as well properly. I'm going to lead us through a breathing exercise, which is taught on the Yoga4Health program. And then we're going to go into a bit more detail about the Yoga4Health program itself. I hope that's okay with everyone. Of course, you don't have to participate. That's fine as well. And to save my voice a little bit, I am struggling a bit, I've lined up a video for us to breathe along to. And one of the practices that is worked up to in the Yoga4Health program is a breathing practice called coherent or resonant breathing. Generally, this is practiced with an equal inhale to exhale. So if you were breathing in for 5, you would also exhale for 5 as well. And the ideal ratio is seen to be breathing in for 6 and out for 6. It's something that is worked up to. The video that I'm going to show us is breathing in actually for 5.5 seconds and exhaling for 5.5 seconds. But I liked the graphic the most. I'm very much a visual person. And so in order to do this, you're going to be aiming to breathe in and out the nose. We're aiming to breathe lightly and gently. And so if it makes more sense for you to come and lie down to breathe, you'd be more than welcome to do that as well. And although I'm going to line up the video, I am going to count us in so that we do a few breaths all together. And then I'm going to let the video play for just a few minutes. And we can have a bit of an experience, a bit of a submergence into one of the key practices that is delivered on the course. So I'm just going to bring up the share. Give me a moment. Oops. Just come out of that. Don't know if I'm going to be able to do this now. Let's see. Sorry, technical issues. Right. So, can everyone see on here HRV breathing? Perfect. That's going to start shortly then. So make sure that you're in a comfortable position. You might just choose, if you're sitting, maybe sit up a bit taller, maybe move away from the back of the chair if that's comfortable. And you might just take a couple of rolls of the shoulders up, back and down. Maybe that feels like enough. Perhaps there's some need to move the head, to wiggle the jaw, to maybe take a couple of sighs out. Lovely. And I invite you to just let the shoulders relax. And actually you can keep the eyes open. And just take a moment here to start to notice your natural breathing without changing it. And just start to see if you can make your breathing 2% softer. We often think that breathing deeply is about breathing with force. But in true relaxation, we would breathe light and gentle, low and slow, down into the abdomen. If it's useful, you're more than welcome to rest a hand on the belly, one on the belly and one on the heart. And as you breathe in, you want to feel a bit of an expansion of the belly and the lower ribs. And as you breathe out the nose, you feel a softening of the belly and the lower ribs. Then from here, we're just going to start breathing. And I'm going to introduce a count, which will get gradually longer and take us up to a 5-second inhale and exhale. And you can sync up with me when you're ready. And you'll just need to resync with the video when it starts. Inhaling, 1, 2. Exhale, 1, 2. Inhale, 1, 2. Exhale, 1, 2. Inhale, 1, 2. Exhale, 1, 2. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Inhale, 1, 2, 3, 4. Exhale, 1, 2, 3, 4. Inhale, 1, 2, 3, 4. Exhale, 1, 2, 3, 4. Inhale, 1, 2, 3, 4. Exhale, 1, 2, 3, 4. Inhale, 1, 2, 3, 4, 5. Exhale, 1, 2, 3, 4, 5. Inhale, 1, 2, 3, 4, 5. Exhale, 1, 2, 3, 4, 5. Inhale, 1, 2, 3, 4, 5. Exhale, 1, 2, 3, 4, 5. Just keep on breathing in and out for 5. I'm just going to start playing the video. Whenever you're ready, you can start to synchronize with the sounds and with the image. And last one. Just notice how you feel. Maybe just noticing a sense of shift or change from a few moments ago. Maybe sensing a similarity. Maybe sensing a shift towards a kind of a steadiness, a calm alertness, kind of what I describe it as. Feel free to take a breath in by now. Feel free, if it's needed, to take a sigh out the mouth. Let's just get back to the presentation. So I'll be sharing again, coming back into here. Yeah, coherent breathing is a wonderful practice. It's one of the kind of kind of key things that we teach in the Yoga for Health program as a kind of secular practice. As I said, we teach it as an inhale and exhale for 6. That video we practiced was a 5.5 second inhale and exhale. And if you're breathing in and out for 6, it means that we're breathing at just 5 breaths a minute. And generally, when I see people, when I work with them, I'm seeing a lot of people who at rest are breathing somewhere between 12 and 14 breaths. So you're kind of reducing someone's breathing rate by about half, which has huge benefits on things like lowering down the heart rate, lowering down someone's blood sugar levels, reducing blood pressure, and also increasing over time someone's heart rate variability, which is that measure of flexibility of the nervous system that is an indicator for how resilient we are against life stresses. And so it has a huge amount of kind of mental and physical health benefit. And so here a little bit of detail about social prescribing. It's obviously the prescription of a social activity for those with health issues and or social isolation, which can be done by a GP, community centre, other health professionals, such as social prescribing link workers. And the idea behind it is that loneliness is a serious risk factor in chronic disease. And so it's looking at prevention and management and really looking at social activities, helping to create relationships that lead to healthier and happier lives and to better health behaviours. And it's very much a kind of cornerstone of the NHS long-term plan. The programme helps to provide or combine, I should say, the benefits of social prescription with yoga to help to provide a dual strategy for enhancing well-being, and is really aimed at early stage health condition to help to improve them and therefore act as a prevention from further chronic conditions. And very much looking at social connection as a tool that is also going to work as a preventative and as a buffer against future long-term chronic conditions. It's seen as an early intervention for those who are pre-diabetic, for those with mild depression, mild anxiety, or mild to moderate depression, mild to moderate anxiety, social anxiety, and those who are socially isolated. And the programme is also very appropriate for those with lower back pain. Originally, it was going to potentially include lower back pain as well. So it's very much been designed with that in mind. And the format of it is, it's a 10-week course, each which has 2-hour weekly sessions. And it starts off with a kind of gathering together, some psychoeducation or teaching yoga off the mat, and a kind of talk around home practice, which is a very big key element of the Yoga4Health program. And each week builds on one another. And what the wonderful thing about the program is that you teach both chair and mat yoga alongside one another in the same class. It's tough to teach as a teacher when you're first new to it, but it's amazing how much you adapt to it. So I had, when I was teaching, the evaluation I would have, it could be 50-50, it could be 60-40, some on the chair, some on the mat. Some people would be chair-based the whole way through, but others would come up from the chair and onto the mat for certain postures as well, especially as they kind of started to learn about their bodies a bit more and about their physical capabilities. And the sequence is the same each week, which gives people empowerment, it gives people confidence, and it helps people to see improvements as well in how, they are performing the physical postures. It then includes a relaxation activity. This is really to promote a kind of parasympathetic shift in the nervous system. There's then a breath practice, which is again working towards parasympathetic activation and an increase in HRV. And although coherent breathing is what we teach at the latter part of the course, there's a kind of staged approach to starting to elongate the exhale and then to start to breathe slightly more equal breaths as the weeks go on. And at the end, there's a group discussion, which is a really great opportunity to help to clarify and connect and share. Each student receives a student manual and online resources, and all of that's available to them even after the course finishes. And there's suggestions in there for practice to do at home as well. This is a little bit of an example of what, when you get a subscription, you've been a participant on the course, you get access to YouTube videos, even for the whole sequence as well. And yeah, the research that I was very lucky to be a part of. So it was actually funded by the West London Clinical Commission Group. It was undertaken by health psychologists at the University of Westminster. And in total, 279 participants went through the programme over 22 different groups, which started out at about 15 people per group, roughly. And really, the research was looking at understanding if there was any change in psychosocial measures, understanding patient activation measures, understanding any cost-saving benefits to the NHS, and then also looked at waste measurements as well. And it had some great research, which was published, well, it actually was published after, literally just after we spoke, after I came in last time. And patient activation measures went up significantly for 62% of patients. Stress was significantly down. Depression was significantly reduced. Social connectedness was significantly increased. A sense of well-being, including life satisfaction, purpose, and happiness, was up. Falling anxiety rates and physical health showed meaningful improvements. And 45% self-reported better health. Interestingly, from a kind of quantitative point of view, waist circumference was reduced by about 14 centimeters, which is a really significant shift in 10 weeks. And the Yoga4Health cohort ended up having a lower than average perception of stress by the end of the course than compared to the UK population. And, you know, people experience a statistically meaningful improvements in anxiety and depression. And overall, the course decreased ratings of social isolation and increased a sense of connection with others. 80% of patients reported improvements in their stress levels, mental and physical health. And the great thing is that 3 months post follow-up, perceived stress, anxiety, depression, and social isolation all remained low, which was really, really reassuring to see. And we think that this was in part because there was such a high uptake of people still practicing yoga twice a week, even 3 months after the program had ended for the clinical evaluation. And yeah, about 44% had started attending local yoga classes. 50% were still using the resources provided to continue the home practice. And there was a return on investment, which is the thing that the NHS looked at most importantly. I'm going to share these quotes with you afterwards. You're more than welcome to obviously have a scan through them now. I think that they're very powerful. And there was a qualitative study done in 2022 looking at all the kind of verbal feedback from focus groups. And there were just some really, really lovely outcomes from there, some really lovely statements about the program. So we've now got 2 pieces of evidence sort of talking about it. And some news that's new is that in recent months, the Yoga4Health course has now gained PCI accreditation, PCI being the Personalised Care Institute. And it's really seen as the gold standard of courses that are eligible on social prescription. And PCI accreditation helps to recognise person-centred care and expands the offering of existing courses, of our existing course, to talk a bit more broadly about wider lifestyle measures. And this has made the course more attractive for future social prescription and funding opportunities, which is great. And so what next? And I'm conscious of time, so I'm going to speed through this. One of the great things is that we've had a book published. I've got my own copy here. Sorry, it's just gone out of focus on my camera typically. But it's the Yoga on Prescription. It is available off Amazon or also on the Yoga4Health website as well. But it gives so much detail about the rationale behind the course. And so that with this aim for Yoga4Health, or for YIHA to start to make it, you know, potentially an international thing that might grow, and to also give it a real validation to healthcare professionals who might look to prescribe it as well. And excitingly, Yoga4Health is literally in its infancy of a staff well-being program. And there are some, you know, statistics here about NHS staff well-being, which you can imagine is not great given the current constraints and the pressures that they're under. And so, yeah, the staff wellbeing pilot has commenced. It's going to be a 6-week program with 60-minute classes, and they've just started their first cohort for the pilot this week, I believe, or maybe it was last week. So hopefully that's going to be rolled out fully next year as a pilot scheme, with the intention of it being delivered more widespread across different NHS trusts to staff. And we're really hoping that if staff can speak to the efficacy of the Yoga4Health programme, staff wellbeing programme, then we might see more people or more opportunities for uptake of the Yoga4Health patient programme. And there's been some really good success stories since I last came to speak. A company set up by a yoga teacher, which goes under the name of Yoga for All, is offering paid and funded places in Westcliff. And people can either self-refer through them or get referrals through their GP or other health professional. In Staffordshire, one of the yoga teachers for the Yoga4Health program has received part funding through an organisation called Everyone Health, and that's council funds, which helps support the running of the Yoga4Health classes. A company that supports self-employed people and entrepreneurs called Unlimited gave funding for Yoga4Health, or the delivery of the Yoga4Health programs in Dover, as Dover's kind of earmarked as an area experiencing deprivation and reduced health. And then my own kind of link is that I'm currently working with PCN, or Primary Care Network, in South East London CCG. I'm currently delivering classes which are labelled Yoga for Relaxation, but I'm hoping that this is an avenue that we might then start to work together and offering Yoga4Health alongside Yoga for Relaxation, although we need to look at funding and what's available for us in the next year. And then so finally, in this point here, it's very much that the evidence is clear. Yoga is an evidence-based intervention and a strengthening activity that we now work. So when speaking at the first Yoga and Healthcare Alliance conference, Duncan Selby said that now is your time to Yoga4Health teachers. That's me. I'm going to stop record, I think. Yeah. So I'm just going to stop.